Hello everybody, I'm Dr. Tabor Smith. Today I want to talk to you about spinal hygiene. Now you've probably heard of oral hygiene or taking care of the teeth, right? Most people, in fact the CDC says 65% of Americans see their dentist regularly. And I think it's safe to say that more than 65% of Americans brush their teeth every single day. When it comes to chiropractic though, most studies show that less than 10% of people see a chiropractor regularly. And I would say it's safe to say that even less than 10% of people actually do stretches and exercises to keep their spine healthy. Your spine is much more important to keep healthy than your teeth. The spine and nervous system control everything in your body, every function of your body. Now sure, the teeth are very important, they help us chew our food and do other things, but we can get new teeth. We can't get a new spine. So it's so important to practice proper spinal hygiene. Now I'm going to show you how to do that. What do we do every day to keep our teeth healthy? We brush our teeth. I'm going to show you how to brush your spine to keep it healthy. Now everybody should take their spine through a full range of motion every single day. If you see kids, they run and play and are in crazy different positions every single day that keeps their spine moving. And we don't see a lot of back pain in kids. We do see some, but not a lot because they keep that spine moving. As we get to be an adult, we don't move as much. We maybe even get a desk job or we're in our car all the time and our spine just loses its range of motion. You have 24 movable segments in the spine and each one of them needs to have a full range of motion in order for the joint to be healthy. So, what I recommend you do every single day is take your spine through its full range of motion. We have 6 planes of motion in the spine. Forward flexion, backwards extension, left lateral flexion, right lateral flexion, right rotation, and left rotation. That's 6 planes of motion. If you'll take it through those 6 planes of motion and at the end of the range of motion, hold it for 10 seconds. So 1, 2, 3, 4, and so on until you get to 10, and then do the next range of motion. 1, 2, 3, 4, and so on until you get to 10. That's the cervical spine range of motion, and the same thing goes for the lumbar or lower back range of motion. Forward, back, side to side, and rotation. You should do that with both the low back and the neck every single day. And that's comparative to brushing your teeth. And I call it brushing your spine, taking your spine through those full ranges of motion. Now, you'll notice even though somebody brushes their teeth every single day, they still need to see their dentist regularly. I remember when I was a kid, I brushed my teeth every day, every morning and every night. But you know what? Sometimes when I went to the dentist, I still had a cavity somehow. And that dentist would have to fix that or correct that. Same thing with the spine. We need to do these range of motion stretches and exercises every single day, but we also still need to see our chiropractor to make sure that we don't have a problem in the spine. And if we do, to make sure that it gets corrected. Because remember, your brain and spinal cord control every function of your body. And your spine houses that brain and spinal cord. So that's how important it is to practice proper spinal hygiene. I hope you've learned something today with this video. Thank you for watching and have a great day.